Advice on ER contract negotiation. Hey, what's up guys? My name is John. I'm an emergency medicine physician assistant. And in today's video, this PA is saying that they are going to take a huge pay cut and would like some advice, and I'm here to help. I'm needing advice on how to advocate for the APPs in my ED and negotiate better wages against a big corporate staffing company. My ER is transitioning from one staffing company to another in the next few weeks. This new company sent out APP contracts today. They're decreasing wages from $88 an hour to $75 an hour once they take over. Our contracts do not mention any potential salary increase structures or CME allowance. We were previously making $75 an hour for a long time, but this was increased within the last year to $88 an hour due to poor staff retention. Staffing retention improved and schedules have been better. With this new rate, everybody's angry and morale is very low. This whole thing sounds like a very discouraging situation. The physicians have been trying to advocate for us, but I don't think it's enough. The staffing company is planning on stopping by the department for a few short hours in the next few days so we can speak with them. They talked about scheduling a department meeting, but no time has been set. We are getting pressured to sign our new contracts, and I absolutely would not sign that new contract if you are not happy with that new rate, because once you sign on that dotted line, you're kind of stuck. And usually a lot of these contracts say, there's a minimum amount of time you have to work for, or there's at least a minimum amount of time that you need to tell them that you are staying or not. So if a lot of people hold off on signing this contract, you might have a little bit more negotiation power when they're like, I guess all the PAs are about to leave, so we really should start looking for new people. I was planning on speaking with them about the following below: advocate to keep our same salary due to low morale and staffing, question payment structure and ask about CME allowances, and I will pull data for the APA salary report. Does anybody have any other suggestions? Here's some nuance about my advice all the time. I do not know where this person lives. I don't know their area. I don't know kind of what their going rate is, what their volume is in their department, how they're currently staffing their department. They're also an experienced PA. They've been at this location, it seems like, for some amount of time. Those are some positives for them. When you're an administrator and you're staffing the ER, you have different goals than the people who are actually working in the ER. And I also question if this is one of those situations where some new managers coming in, they want to look good for their higher ups. And so they're going to go cut the hourly rate. They're going to go do XYZ changes. They're going to reduce the staffing. And then 6 months from now, 12 months from now, they're going to be like, look, I saved our company all of this money. I'm deserving of my yearly raise, right? We have to remember that the people who are doing the schedule, the administrators, sometimes are not aligned with your best interest. There were some other comments on this post, which I will highlight because I think that they had a good mindset and also some good advice. One person said, good retention equals more experienced people, equals more efficiency, equals more RVUs per hour. Simple as that. It is in their best interest. And I agree. If you have high morale, good staff, and people are excited to work there, happy to work there at $88 an hour, they will be seeing more patients. Now, if they are not seeing more patients, okay, you could get rid of them. Right now, it seems like the arrangement is in the company's best interest. Somebody else also commented, when I started in the ER, the rate was $75 an hour. That was 5 years ago. COVID, inflation has driven the cost of everything up. Your CMGs are all plenty profitable, which they are. Don't let them tell you otherwise. I'm going to be returning to this group now with an updated rate of $113 an hour. Surrounding markets have all been offering $100 an hour or so for the past year. Overall, using the AAPA salary report, looking in the area around you, seeing some other wages is a good idea for when you go to the negotiating table. I did a whole video, guys, on negotiations, negotiating your salary. So go check that video out. It is linked in the video description down below. I would also, for this situation, talk to your coworkers, get a group of people together who are concerned, not just the doctors, get the other APPs, the other PAs and NPs together, voice your concerns together. Don't go in on this alone. If they feel like one or two people, they're just rogues, they're going to leave, whatever, everyone's replaceable, which is true. When they realize, hey, the whole department might be leaving due to these changes, maybe they will change their tune or at least meet you guys somewhere in the middle. You really have two choices. Stay at the current rate that they're offering, advocate for a change, and if they do not change, you have to be ready to leave. I did write out a response, which I will read, but before I do that, if you guys can please hit that like button down below. It really helps the channel out so much, really helps us get seen by more people on YouTube. You're looking at a $20,000 pay cut, give or take, depending on how many hours you work. Experienced PAs in the ER are worth more than $75 an hour. And it is true nowadays. It is 2023, guys. When I got into the emergency department 5 years ago, I mean, yes, they were paying PAs $60, $65 an hour, but now we are living in the time of COVID, inflation, and the price of everything is going up, from cars to houses to your regular groceries. And I've been seeing more and more PAs now in the 70s, in the 80s, in the 90s an hour. When locations are desperate, they're paying $110, $120 an hour for a warm body able to move patients, which is also, once again, my experience. I'm currently leaving a job and they are offering the new PAs going there $110 an hour. It is a 1099, so that does not include taxes, but they're desperate. And I was working a locums contract for 2 months. I was making $190 an hour. Now they're paying $120 an hour. And that's the going rate for when a facility needs a PA in the ER. We, the PAs, save companies hundreds of thousands if they subsequently have to staff those shifts with physicians. When you're paying ER doctors $175 an hour, $200 an hour, some of these docs are getting $240, $280. I've heard of some docs getting $300 something an hour. You are losing out on money. It's just simple math. We also still generate good money. I see about 250 to 260 patients a month. I'm generating millions in collections for the organization per year, with the last year, at least if I remember correctly, being about $4 million. And I acknowledge that not everybody pays their bills in the ER. These are just the amount that is requested to be collected. For the company, it is a small price to pay $200,000 to $250,000 a year towards my employment, which I'm saying includes wages, taxes, benefits, malpractice, credentialing, various other expenses. How much money the company is paying you is not the only expense they have. So I'm accounting for the fact that, yes, there are other expenses associated with your employment. However, you still are making them a ton of money. There are also costs associated with finding a new PA. Guys, do you realize how many text messages, emails, recruiters that they're paying to get skilled labor into the emergency department? It costs them thousands of dollars. It will cost them months to find people. It is not easy to staff all of these facilities. When you're bringing in somebody new into the department, there's always that X factor. Are they going to work well with everybody? Do they have a good work ethic? You do not know anything about them really, especially if they're a new grad. How are they going to perform in your department? You know, if you lose 1 or 2 people, it is what it is. But if in this situation, they're doing a huge pay cut and they rid the entire department of people, that could be a bad situation. As others have said, inflation is through the roof. People have left healthcare after COVID. You should be firm in telling them that if they implement these changes, you will be leaving. When they realize they need to find and train a handful of PAs or NPs all at once or fill physicians into the shifts, they'll realize how much money they lost. I said lost as an implication, like if everybody left, they're going to lose a lot of money, at least temporarily. They'll get rid of the experienced PAs that they're paying $88 an hour and try to find some new grads at $68 an hour. They don't care. I mean, at the end of the day, they have somebody staffing the department. What is good for the department? I think what would be good for the department is keeping morale high and keeping them at 88. Guys, if you have any comments about this situation, please leave them in the comment section down below. I do read all of the comments. Check me out on Instagram for more stories and posts on the life of a physician assistant. And guys, as always, stay safe out there. Have a great rest of your day. Bye-bye.